Hello guys, today we are going to discuss about the small topic which is very important, nothing but minerals. What are minerals and what are the sources of minerals and what are the deficiency disorders of minerals and what is the dietary requirement, everything. We'll just see a brief introduction and conclusion of the minerals. What are minerals? Minerals are nothing but they are called organic salts. Generally, the minerals are classified into two broad terms: major minerals and the trace elements. These major minerals are required in large amounts in daily requirement. They are nothing but calcium, sodium, potassium, manganese, and phosphorus. Whereas trace elements, these are nothing but iron, iodine, fluorine, zinc, copper, cobalt, chromium, and manganese. Coming to the first and foremost element, calcium. Today we are going to deal briefly about calcium. The main element or the main importance of the calcium is that it is essential for several life processes. It's mainly stored in two main components of the body, which are nothing but the bones and teeth. And the blood level of the calcium is about 10 to 11 milligrams per deciliter. And the daily requirement is 600 milligrams for adults and for growing children. And in pregnant and lactating mothers, the daily requirement is increased. It's nothing but 1200 milligrams. And the calcium sources are available in two categories: animal sources and also the plant sources. Whereas the animal sources are mainly milk and the milk products like ghee, milk, or any other milk products, and egg, fish especially. And plant sources, nothing but the ragi, green leafy vegetables, and other cereals, etc. And in cow's milks particularly, for 100 ml of cow's milk we get 120 milligrams of calcium, and for 100 ml of human milk, it's when compared to the cow's milk, it's very less. It's 30 milligrams of calcium. Green leafy vegetables have a oxalic acid and cereals have a phytic acid. So these, when combined with the calcium, form insoluble substances. So they are somewhat difficult for digestion or absorption of calcium. And mainly the calcium is absorbed by the vitamin D, and the calcium reserves in the body are maintained by the interaction of three main components, nothing but the vitamin D, parathyroid, and calcitonin. These three together play an important role in maintaining the equilibrium of calcium. We can observe two main things. Some minerals have a deficiency disorders, and for some minerals, if they are very excessive, they also produce diseases. But for calcium, there are no diseases due to the excessive deposition. And if there is any deficiency of calcium, it will cause osteoporosis, which is nothing but resorption of bone. And we also can see growth retardation in children. And some other sources of calcium, I'll just briefly discuss or mention about this. Leafy vegetables contain 200 to 400 milligrams of calcium per 100 grams. Ragi 344 milligrams per 100 grams. And fish 150 to 3500 milligrams per 100 grams. Cheese contains 790 milligrams per 100 grams. This is all briefly about the calcium and the introduction of minerals. Thank you.